Hey guys, welcome back to the Pulling Curls podcast. Today on episode 250, we are talking about reasons your birth might be extra hard. Let's untangle it. Hi, I'm Hillary, a serial overcomplicator. I'm also a nurse, mom to three, and the curly head behind Pulling Curls and the Pregnancy Nurse. This podcast aims to help us stop overcomplicating things and remember how much easier it is to keep things simple. Let's smooth out those snarls with Pregnancy and Parenting Untangled, the Pulling Curls podcast. The sponsor of today's episode is the online prenatal class for couples. We're going to talk more about it later, but if you're looking to get prepared, come join me. Okay, first reason your birth might be hard is that you don't mesh well with your doctor. Either you don't like them, like you dread every single appointment, which happens, or you guys don't mesh. Sometimes I would get patients who would come in and I would ask who their doctor was, and I'd be like, seriously? That's who you picked? It would just be super surprising to me. Then often later on, I would then find out that they didn't get along well with their doctor and they were kind of stuck with them. So if you don't like your provider and you're less than 30 weeks, I 100% recommend shopping around. If you're past 30 weeks and you don't like your provider, I would recommend still shopping around, kind of calling your insurance and seeing if you can switch, things like that. It just gets trickier. There's some providers, especially small groups, that do not want to accept people after 30 weeks. If you're looking to switch providers, you might want to look towards the bigger offices, which might give you a larger variety of providers as well. But if you have a provider that your birth plans or your birth thoughts and mentality, your birth aesthetic just doesn't match, it can make birth really tricky. So I just want to put that out there. I know it can feel like a pain to change your provider, but could be worth it in the end. By the way, I have a whole post on more of my thoughts about these 5 reasons, so I will put the link in the show notes as well. Okay, reason number 2 is that you've had previous uterine surgery or previous cervical surgery. Now, a lot of people don't think about the cervical surgery. Usually it's called a leap. That's what I see most often. It's when your pap smear comes back and there's a few abnormal cells, and so they'll do something called like a cone biopsy, or they kind of freeze some cells. That can create, it doesn't always, but it can create scar tissue on your cervix that can make it difficult to dilate. So think of it as you put a hot poker on an elastic band and then you try and stretch that elastic band. Obviously, the area that's been scarred by the hot poker may not stretch the same way. Sometimes it does totally fine, or sometimes it just has to stretch extra and then boom, it stretches and you're great. But it's something to be aware of. If you've had previous uterine surgery, there's a good chance you might need to have a C-section. So these are just things to consider. Usually previous uterine surgery people know, but a lot of people don't know about the cervical surgery. So I wanted to put that in there as well. Okay, tip number 3 is that you can't speak up for yourself. If you're at your appointment and your doctor orders something and you're kind of like, why is he ordering that? But you feel too timid to ask why or ask more questions, there's a chance your birth's going to be hard, because a lot of birth is making choices for yourself. And if you can't do that in the office, it's only going to be worse when you add the pain and the anxiety of being in the hospital. So I always recommend that people start speaking up for themselves very early in pregnancy. I will say that for kids who are young, have a really hard time speaking up for themselves. And so if this is a quality that you don't possess, start doing, I know it's going to feel real weird, but do role plays with friends about ways to talk with your provider. Look for people that frequently talk with providers. And tip number 5 is going to give you more tips about this, but looking for ways to talk with your provider just about simple things will prepare you to talk about the bigger things when you're going in for your birth. Okay, number 4 is having very solid expectations. A lot of people feel like if they think and plan for a specific type of birth, they can manifest that. And I'm here to tell you that you can't, right? If you've thought your whole time, I'm not going to have a C-section, I'm not going to have a C-section, I swear the only thing your head hears is C-section, and that's where you end up going. And I know a lot of people say, oh, it's the nurse's fault. But a lot of it really is your attitude towards, I can make this birth be what I want it to be. And I get that. Like, I'm that person in real life, right? Like, I can make this situation be what I want it to be, when in reality, the situation is going to be whatever the heck it wants to be. And so I always encourage you to think positively about your birth, plan for your birth, prepare for your birth, but having super solid expectations, which may get dashed, can really make birth hard. If you are so set on not getting an epidural, yet you needed to be induced and you made the choice to be induced early, and you're in hour 32 of labor and you're so tired and so miserable, and then you get an epidural and then you're just like mad at yourself and you're traumatized by the choices that you've made. I just feel like you would have been better off if you had not had such solid expectations. Sure, we're going to go in, I'm going to try to not get an epidural. I've prepared in these different ways, but I'm ready to go with the flow. I think being able to go with the flow is so important in labor. One of the best ways to make birth easier is to go with the flow. So that's my best tip there. All right, tip number 5 is that you are not prepared for birth. And getting prepared is so important. And I really feel like a lot of people think that it's your provider's job to prepare you during delivery or at your prenatal appointments. And I'm here to tell you that they just can't prepare you for all the things that you should be prepared for. And you've been pregnant these whole 9 months. You have the opportunity to get prepared. I remember when I was in the hospital with my appendectomy, I was thinking, gosh, I kind of wish I could have taken a class about appendectomies because I had no idea what to expect. Obviously, I couldn't. I mean, I guess everyone could take it, but you'd probably forget it and it would just be dumb. But you're pregnant. You know that it's coming. So I would encourage you to take a birth class. Make sure that you're taking a birth class that actually prepares you. It's not just a birth class to mark it off on your things to do before a baby's born. I took a birth class in 2000 that checked off take a birth class. Did it prepare me? Absolutely not. Woefully unprepared for life after baby was born and taking them home. I think they showed me how to change a diaper, but did they talk about what my bottom would feel like or my emotions or how difficult breastfeeding could be and how to get resources for help? Absolutely not. Ugh. If I could go back in time, that's one of the big things I would change. And so when I created the online prenatal class for couples, I created the birth class that I needed back then. And it's the birth class that you need now. It is going to prepare you for the rest of your pregnancy. We talk about third trimester testing, labor, including laboring at home, which is a really important thing to know how to do. Laboring at the hospital, birth, and postpartum, both at the hospital and when you go home. So come join me in the online prenatal class for couples. Let's get you prepared. Let's bypass a lot of these things. Obviously, some of them you can't change. If you're stuck with a provider because of your insurance, a birth class can still circumvent any of those issues and help you communicate with them better. And it's going to help you know about things like cervical scarring, because there are other things about your body that can be problematic. So you just know a little bit more of what to expect, so you're not having poor outcomes because your expectations are different than what actually ends up happening. Okay, I hope you guys enjoyed that episode. That post is super popular, so feel free to check it out in the show notes. Next week, we are talking about moving my parents into retirement living, which is, I think, something everybody needs to learn about. And the week after that, we're talking about strength training, which is funny because I definitely strength trained moving them. So there's that. Thanks for joining us on the Pulling Curls podcast today. If you liked today's episode, please consider reviewing, sharing, subscribing. It really helps our podcast grow. Thank you.